Hello, my name is Sumit Dar. I'm the principal investigator of the Auditory Research Lab at Northwestern University. Our lab works in two areas. The first area is to try to figure out how the inner ear works for a specific purpose. Turns out that there are many little tiny structures in the inner ear that have to move in synchrony for us to be able to hear. And one of these groups of structures are a special set of hair cells that can elongate and shorten in response to sound, thereby amplifying soft sounds and enabling us to hear them. In the process of this amplification, they also make their own sounds. And these sounds can travel all the way to the outer ear, and we put in miniature microphones in people's ears and record these sounds. The idea is to use these sounds generated in the ear, recorded in the outer ear, to be able to tell what might be going on inside the ear that is allowing us to hear well. Lately, we've been trying to use these sounds to build better tests to be able to tell when something is going wrong in the ear. For example, the earliest signs of aging. Can we catch the changes in these sounds that the ear makes to be able to tell that change is coming? Or the same for some other diseases. The basic idea is to detect things early, detect things accurately. In another line of work, we are interested in making hearing healthcare more affordable and accessible. So turns out that only about 30% of the people, so 70% of the people who have hearing problems, measurable hearing problems, don't do anything about them. And the other 30% go do something, but of that group, very few actually end up using, say, hearing aids that help them. Now, why is this? We are trying to understand what are the barriers. Is cost a barrier? Can we reduce that or other barriers, enabling more people to come to hearing healthcare in a timely way and use the appropriate care? So it turns out this is pretty important because every passing day we are becoming more aware that untreated hearing loss has some pretty significant associations with other detrimental health, social, and psychological problems. So when possible, we would like to treat hearing loss as early as possible, as best as possible. So that line of work is focused on improving affordability and access to hearing healthcare. Today, I wanted to tell you about a project that we have just started. It's a project that is trying to figure out whether different ways of fitting hearing aids lead to this similar outcomes. And this is in anticipation of the day soon when we are able to acquire hearing aids over the counter. So you have to be between 50 and 79 years old, have mild, moderate hearing difficulty. Then we do some screening, and if you qualify for the project, you have to commit to buying a pair of hearing aids for $650. This is a deeply discounted price for research, and the hearing aids are for yours to keep. We will ask that you use the hearing aids in accordance with the study for 6 months, which is the duration of the study. And after that, we can get them reset to how you like them or how you prefer to have them set up. So if you're interested, if you are experiencing, or if you know anyone who's experiencing mild, moderate hearing difficulty, is within the 50 to 79-year-old age range, send them over to p-chat.soc.northwestern.edu, and they can launch from that website and get registered and be part of the study. At the end of this video, we'll also give you the URL and email address, phone number for you to get in touch with us. Age when you start to lose your hearing is a very difficult question. Let me try to answer it in several different ways, and maybe one of them will resonate with you. So one way of looking at it is to say, okay, in the US, about a third of the people over 65 years old have measurable hearing loss. Half of those over 75 years old have measurable hearing loss. Another way of looking at it, very relevant today, is the WHO just came out with a statistic that says of everyone living in the world, 1 in 5 has significant or measurable hearing loss. And by 2050, it's going to be 1 in 4. Yet another way of thinking about it is with every decade of age, the number of people with hearing loss doubles. Now, all of these ways of thinking about it is good from a population perspective, but it doesn't say anything about you, right? So when one person or you will start having hearing loss depends on a variety of factors. Some of them are genetic, but much of how hearing loss progresses is environmental. How much noise exposure have you had in your lifetime? Did you ever have to take any medication that accelerates hearing loss? So those factors determine when you personally will start having hearing loss, and a number is hard to pin down for any given individual. There is a scientific answer to the question, when does hearing loss start? We've done a lot of work in our lab over the last 5 to 7 years to try to answer that question. And in our hands, if you started with average hearing that a 10-year-old has and asked the question, at what age, on average, do we see significant changes from that hearing ability? We would start to see those changes in the 30s. So contrary to what people would think, being age-related hearing loss or old age hearing loss being in the 50s, 60s, 70s, the slight changes in hearing that ultimately lead to a significant hearing loss start as early as in the 30s. How you know you have hearing loss is a very difficult and complicated question. I would say trust others to tell you when you have hearing loss before you trust yourself. Why am I saying that? Well, we as very resourceful human beings often will adjust our environment. We'll turn the TV up, we'll turn the car radio up, we'll avoid going into situations where it's difficult to hear, just so we don't face the difficulty in hearing and communication. So now that you know that, you can look for some signs. Are you turning the TV farther up than you used to before? Is your car radio higher than it used to before? Are you avoiding situations like a party, like going to meet friends at a restaurant or going to meet friends over coffee because you have trouble communicating in those circumstances? You may be starting to have some hearing loss. But then going to the other aspect, which is trust others. Trust your loved ones, trust your friends, trust your family when they say that you're asking them to repeat themselves more than often, that you're having difficulty understanding what they said, even though you are within earshot or within close proximity, and act on it. It's not that difficult to get a hearing test or to get your hearing evaluated by a professional. There are other things that are becoming more and more available for you to get a rough estimate of how good your hearing is on your own. So take action and you'll find out.
So the American Speech Language Hearing Association recommends that you get your hearing tested every 10 years up until the age of 50. After that point, it's recommended that you get your hearing tested every 3 years. Now, if a hearing loss is detected, the recommendation is that you get your hearing tested every year. And there are some other reasons why you should get your hearing tested. For example, if you actually notice a change in your hearing, it's probably a good time to get your hearing tested. And if you have previous exposure to noise, so if you've worked in a noisy factory, woodwork, hunt, those might be other reasons why you should actually get your hearing tested to make sure that there hasn't been any changes to your hearing due to noise exposure. So there are some medications which can contribute to hearing loss, and that's something that should definitely be discussed with your general practitioner. And if you have been informed that your medication can cause hearing loss, it is recommended that you get a hearing test quite regularly to monitor any changes in your hearing. There are a couple of things to consider when deciding whether or not a hearing aid is right for you. And the first and probably most obvious criteria is, what does your hearing look like? The best way to find out is to see an audiologist or other hearing healthcare provider and get your hearing tested. This is really important because it can give us information on what you might be missing in day-to-day interactions, but it's not the end-all be-all. So we know that two people can have the exact same hearing loss and perform very differently. So while the hearing is one piece of it,
The other is the day-to-day experiences you're having when you're interacting with other people. So one thing I always ask my patients is, do you find that it's easier to not engage socially with others? For example, maybe not going out to eat with friends as often, maybe not engaging with family and friends in conversation because it's just easier than actually trying to follow the conversation. That's a pretty good sign that it might be time to invest in something like hearing aids or an amplification device, just so you can enjoy that communication again with the people that are important in your life. Another thing to pay attention to is how often are you asking for repetition? So if you find that you really can't have a conversation without frequent requests for repetition, something like a hearing aid can give you just that little boost that you need in order to have an easier time communicating with people you care about. And the last thing, if you find at the end of the day that you are just exhausted, fatigued, listening has tired you out, that's a sign that your brain is probably working harder than it should be, or harder than it has to, in order to hear and follow kind of basic communication. So all three of those things are signs that it's probably time to try something like hearing aids.
In order to be in the study, you need to be a certain age, which is between 50 and 79 years. You also need to have some perception that you have hearing difficulties, and we will find that out by asking you some questions. And you need to have never previously tried or used hearing aids in the past. So no use of hearing aids previously. We also require that you are able to understand and read English fairly well. And this is so that you can complete the questionnaires that are going to be given throughout the study. We will be screening your cognitive abilities to make sure that you're able to understand the process of the hearing aid study. And finally, you must be able to pay for the hearing aids for the cost of the hearing aids, which is $650. Okay. Yes, you will be given a hearing test when you first come in for the study in order to verify that you are eligible to be using hearing aids. We will be conducting this study at 4 different sites, 3 in the Chicago area, 1 in Evanston, 1 downtown Chicago, and 1 in Palos Hills. The 4th site will be conducted in Texas at the University of Texas Medical Branch in Galveston. Yes, you must be able to attend 3 sessions, all in person. The first session, you'll be determined whether you are eligible for the study, and you will be provided with the hearing aids. The next 2 sessions will be follow-up sessions where you will be given questionnaires about your experiences with the hearing aids and also given some tests with the hearing aids.
Short answer is you do. You have the chance in this study to buy at a discounted research price state-of-the-art hearing aids. If you decide that you don't want to keep the hearing aids during any point in the study, you can return them and you'll get a full refund. Unfortunately, we do not bill insurance directly for your aids, but if you want to get a receipt, we can give you a receipt, and if you want to submit that, you can submit that to something like a health savings account.
If you're interested in participating in the PChat study and want to see if you're eligible to participate, please visit our website or give us a call. You're going to complete a quick online pre-screening, and if you're found to be eligible to participate in the study, one of our team members is going to contact you within 3 business days.